problem with the septum. The septum is the bone that is in the center of the nose. It's totally bent.
So we'll be addressing narrowing the nasal radix. We'll be working on the dorsum. We'll be reducing this dorsal hump.
So the hump was removed.
Done septorhinoplasty for her, and we have corrected her deviated nasal septum. So today we have removed her nasal plaque, so she's packed, so she is feeling so much better.
We've got a nice dorsal aesthetic line now on both the sides.
Now I'm really very happy to see this.
You didn't remove the nose ring?
Yeah. While taking that, I not taken it. Now only I pick it.
Okay. Are you having any breathing problem? Right side is blocked.
Two sides.
Both sides are blocked. Okay. So because you have a problem with the septum is the bone that is in the center of the nose. It's totally bent. So you'll have to do a septorhinoplasty. Okay. In the rhinoplasty, what we'll do is there is a hump here. We'll remove that. We'll reduce the width of this nose here. We'll reduce the width here, and we'll increase the tip. So it'll look very slender. You'll have a nice dorsal aesthetic line. Now it's bent. This hump will be gone. It will be narrow. And in the septoplasty, we'll correct the septum. We'll make sure your breathing is free. All right. And because we are going to do a lot of work on the septum, we need to do work on the, I'll show you a scan. We need to harvest rib as well. I'll show you how much of a deviation there is here. See, this should be straight, fully bent and gone towards one side, and that is why it is causing the problem. So what we have to do is, this septum, it makes the foundation of the nose, one of the three foundations. So when I remove that bent septum, we'll have to put a straight cartilage there. So that's why we have to harvest the rib.
இங்கே வந்து எனக்கு நோஸ் பிளாக்காக இருக்குது, டபுள் சைடு நோஸ் ரொம்ப பிளாக்ல இருக்குது, ப்ரீத்திங் ப்ராப்ளம் கோசம் ரைனோபிளாஸ்டிக் பண்ணாங்க. டாக்டர் வந்து பெஸ்ட் பண்ணி தரேன் அப்படின்னு சொல்லியிருக்காரு. ஹோப்பில் இருக்கு.
உங்களுக்கு என்ன எக்ஸ்பெக்டேஷன்ஸ் இருக்குது?
ப்ரீத்திங் ப்ராப்பராக இருந்துச்சுன்னா போதும்.
I have a patient here. She came to as a chief complaint of blocked nose. It's difficulty in breathing. So as you see carefully, and she has a very broad radix. Okay, and if you see in the lateral profile, there is a mild minimal dorsal hump, and the tip is deviating towards left side. And if you see in the worm's eye view, the alar base is flaring. So what we are doing today is a functional and a cosmetic septorhinoplasty with a rib graft. We are going to address all these issues. So we'll be addressing narrowing the nasal radix. We'll be working on the dorsum. We'll be reducing this dorsal hump. We'll be working on alar base. We'll be doing increasing the projection of the nose by doing a septal extension graft. We'll reduce the alar base width and correct the functional issue what she's having. So it's going to be a cosmetic and functional septorhinoplasty with a rib graft. Thank you.
Here with this rhinoplasty, we're going to show you some of the side views. We've got a good shape, good projection, and you can see the comparison. So the hump was removed, and this is now, let me show you this one view where it was really flat. Okay, nice. Much improved tip.
So here is a patient Genelia, and she came to us with the difficulty in breathing complaint, and on examination she has this broad and blocked nose. So we have done septorhinoplasty for her, and we have corrected her deviated nasal septum also. And so how are you feeling? So she has a little bit of pain and swelling under the eyes also. So we have kept under medication, and gradually it's going to reduce. And what are you having? Do you have anything?
Yeah, I think you have taken mistake.
Okay, you had anything, food or something?
I can't able to throat is paining for me. I can't able to take anything.
Okay, so we have given you a syrup. Take it, okay? Okay, you have acidity also, right? So take that syrup and have medication properly and eat well, okay?
Sure.
Everyone, so she came to us with a deviated nasal septum and blocked nose. So we have done a rhinoplasty, septorhinoplasty to her. And how are you feeling, Genelia?
Better, right?
So today we have removed her nasal plaque, so she's packed, so she is feeling so much better. And how are you? Do you have any pain?
I don't have any pain.
Okay, so you're good. What did you have today for lunch?
I don't know. Still now I cannot decide.
Okay, you didn't had for breakfast?
I need
Idli you had. Okay, good. Take care. Yeah.
Sorry. Okay. We'll do it. One second. So you can see we've narrowed this dorsum here, and we've got a nice dorsal aesthetic line now on both the sides. The tip has been refined a bit. We're going to show you some of the side views. Here you can appreciate that very clearly. Bring it forwards. So there was a hump, and then there was depression there. The tip was not having any support, so we've corrected that. The other thing is there was a lot of show between the columella and the ala, so we've corrected that as well. Reduce the width of the nose. We're going to show you that view now. You can look at this view and appreciate that the width of the nose has been reduced. So we haven't reduced it overtly because then that doesn't suit the patient's face. Width has been reduced proportionally to retain the racial facial characteristic of a face. And then we've also given that shape, improved that, get a little bit reduced on the tip, more work on the dorsum, on the bony aspect, as you can appreciate from these views. It's nice. Thank you. So கொஞ்சம் கூட ஸ்வெல்லிங் இருக்கு, உள்ளாலையும் உங்களுக்கு அந்த ப்ரீதிங் இருக்கு, பட் நல்லா இட் லுக் ரியலி நைஸ். சரியா? அண்ட் நீங்க திருப்பி முடிச்சுன்னா ஒரு வாட்டி செக்கப்புக்கு வாங்க. அது ஒரு 6 மாசம் கழிச்சு, அதுக்கு முன்னாடி வேண்டாம். அதுக்கு முன்னாடி முடிஞ்சிச்சுன்னா ஒரு செக்கப்புக்கு மட்டும் வாங்க. ஆயின்மெண்ட்லாம் கொடுப்பாங்க. சரியா? வெல்கம்.
I am Genelia I'm from Chennai. For long back, I'm searching for the septum rhinoplastic. Finally, I got this place in Nagercoil, Dr. Richardson. I came for a consultation before 2 months. Then afterwards, I was consulted with the doctor for the septum rhinoplastic. Before 10 days, I got a surgery in this place. Now I'm all right. I'm really very happy to see this. Facility is very, very nice. I want to say about the staffs in this hospital especially. Very nice and very careful. Good job, good persons also here.